Hey guys, Dr. J. Roberts with Ultimate Bariatrics. Thanks for visiting our channel. Today I'm going to be talking about the typical timeline for preoperative care regarding, the progression from your initial consultation in the office to surgery and how long it's going to take you to get back to your job and through the recovery process. For patients going through their insurance company, most insurance policies require a series of dietitian visits. Those can range anywhere from one dietitian visit to 6 dietitian visits. Those typically can only be done one visit per month. And so if your insurance policy requires only one dietitian visit, then a lot of times we can do your surgery within, say, 4 to 6 weeks, provided that you don't require any additional clearances for surgery, such as evaluation by a cardiologist or heart doctor. Maybe you need to be assessed for the presence of sleep apnea. These things need to be assessed for and dealt with prior to surgery, just to minimize the risk of complications. Once we get you to the operating room, surgeries vary in length. The sleeve gastrectomy tends to be one of the shorter operations. It usually lasts about 30 minutes to an hour. The gastric sleeve is typically done either laparoscopically or robotically. The gastric bypass takes a little bit longer. It's usually about a 45-minute to 1 hour surgery. Those patients typically spend the night, whereas sleeve patients in some cases go home the same day. The duodenal switch is also performed laparoscopic or robotically. Those patients also spend the night like the gastric bypass. The duodenal switch does take a little bit longer. That operation usually lasts 1 to 2 hours, and then patients go home the same day. As far as the recovery goes, the recovery process is pretty much the same for all of the surgeries, and it's usually about 5 to 10 days. If you're a person who works from home, a lot of times patients go back to work from home within a couple of days, just the amount of time it takes you to deal with any postoperative pain. Patients that work a desk job can usually go back to work after 1 week. Most of the time, the recovery process is heavily dictated by fatigue, mainly because your calorie intake is quite low. This leads to a lot of fatigue from, relatively trivial tasks. So you wouldn't want to be standing on your feet for 8 hours a day at work for the first week after surgery with very minimal calories. Whereas, patients that have a job where they have to stand on their feet are going to want to probably take 2 weeks off. Usually by 2 weeks, most patients that are on their feet can usually go back to work without any major difficulties. If you're a person that has a very strenuous job that requires a lot of heavy lifting, you may want to take maybe even 4 weeks off just to deal with any incisional pain that you might have with heavy lifting, as you will have some restrictions to activity as far as like heavy lifting for the first 4 to 6 weeks after surgery. So you may need to be on light duty or some kind of activity restrictions during that period of time. My name is Dr. Roberts. I'm with Ultimate Bariatrics. Hope this will give you some information and help you to understand kind of what the typical process is like going from your initial consultation to getting back to kind of like normal everyday life. I hope this helps. We hope you see you soon. Take care.